conversations on these bills. And Rory, if you can just send out a text just saying that we're going to get started. Good morning, everyone. Welcome back to the Public Health and Minority Health Disparities Subcommittee. It is February the 27th. We are more than halfway through session. And I want to thank this subcommittee for all of your good work. We have 4 bills today that we're going to be considering. And we are going to start with the House Bill 887. This is the Maryland Department of Health, Health Commissions, and Maryland Insurance Administration study. Erin, if you can walk us through the bill.
This bill requires the Maryland Department of Health to contract with an independent consultant to study the Health Services Cost Review Commission, the Maryland Healthcare Commission, the Maryland Community Health Resources Commission, and the Maryland Insurance Administration. In conducting the study, the contractor will examine overlap of the statutory and regulatory duties performed by those agencies and commissions, identify statutory and regulatory duties performed by the commissions and MIA that may be more appropriately performed by the department or another commission or agency, identify whether and how the commissions and the insurance administrations could be streamlined to reduce overlap of duties, identify whether and how the functions of the commissions and the MIA could be better aligned to improve effectiveness and efficiency, examine the alignment of the statutory and regulatory duties performed by the commissions and the MIA with the Maryland Total Cost of Care model and the state's participation in the AHEAD model, and recommend any changes in commission or MIA administrative structure that may improve the effectiveness and efficiency of the commission or the agency. And this report would come back to the General Assembly on or before January 1st, 2026.
And there are no amendments.
There are no amendments.
Thank you. Can I have a motion on the bill?
Move the bill. Second.
All right, it's been moved and seconded. Any discussion from the members? Anyone want or need to be heard on this bill? All right, seeing no hands, all in favor, say aye.
Aye.
Delegate Holland, is that a question or just voting?
No,
voting? Okay,
voting.
perfect.
Thank
you. Any opposition? Go ahead and raise your hands in the chat. Seeing none, the bill passes unanimously. Thank you so much. We're going to move to House Bill 97, baby food toxic heavy metals testing and labeling. And I understand that we do have some amendments on this that bring it in alignment with, I think, what California did. So Erin, if you can walk us through the bill and the amendments.
Okay, there is a reprint of the bill that has been provided, and these incorporate amendments that are being offered by the bill sponsor, Delegate Taveras. The bill requires each manufacturer of baby food beginning January 1st, 2025 to test the final product for each toxic heavy metal before packing individual units for sale or distribution in the state. Testing must be conducted by a proficient laboratory at least once a month. On request of MDH, a manufacturer of baby food must provide the laboratory test results to an authorized agent of the department. If you look through your reprint, you'll see on page 2, after line 10, there's an amendment that provides that on or after January 1st, 2025, a person may not sell, distribute, or offer for sale baby food in the state that contains toxic heavy metals that exceed the limits established by the U.S. Food and Drug Administration. And then it also provides that a person may sell, distribute, or offer for sale the baby food that's manufactured before January 1st, 2024, if the baby food product is warehoused and unsold as of January 1st, 2025. There's additional language the bill has introduced, provides that beginning January 1st, 2026, each manufacturer of baby food must make publicly available on the manufacturer's website for each baby food product sold, manufactured, delivered, held, or offered for sale in the state, the name and level of each toxic heavy metal present in the final baby food product as determined by the testing, and sufficient information such as the product name, universal product code, or lot or batch number to enable consumers to identify the final baby food product, and a link to the US FDA's website that includes the most recent FDA guidance and information about the health effects of the toxic heavy metals on children. The bill further requires that if the baby food is tested for a toxic heavy metal that's subject to an action level, regulatory limit, or tolerance established by the FDA on the baby food product label, then the following statement must be included. For information about toxic heavy metal testing on this product, scan the QR code, and a QR code or other machine readable code that allows consumers to access on the manufacturer's website the test results for the toxic heavy metals, and a link to the webpage on the FDA's website that includes the most recent guidance. The amendments further require that if a consumer believes, based on the information gathered through the use of that code, that the baby food is being sold in the state with toxic heavy metals that exceeds limits established by the U.S. Food and Drug Administration, the consumer shall report the food to MDH. If the department determines that a manufacturer has violated this bill based on a report made by the consumer, the manufacturer is subject to a fine not exceeding $25,000 per violation. And if a manufacturer has knowingly and willfully violated this notice requirement, the manufacturer is subject to a fine not exceeding $50,000 per violation.
Thank you. And I already see hands. So let me start with Delegate Lewis and then Delegate Chisholm.
Thank you, Madam Chair, and thanks again to the sponsor. Thank you very much. My question is this: are there other types? Are there other examples in the regulation of baby food similar to what's proposed in this bill? For example, are there laws or regulations that require testing for, I don't know, just random mold in baby food, or like labeling of baby food? Or is this the first of its type? That's my first question.
It's the second legislation. The first legislation was in California for just testing. The thing is that we are imposing we're the first to impose an enforcement mechanism.
Okay, thank you. And this is the first of its, the first proposal of its kind in Maryland with regard to baby food.
In the country.
Oh, okay, great, thank you. And then a quick follow-up, if I may. And then so distracting here. What was my question?
And we do have favorables from everyone, including the realtors and the producers,
Okay, thank you. I remember my question. It is, are there, does this proposal apply to Maryland-based baby food manufacturers? Or does it apply to baby food manufacturers nationwide? We would be requiring them to follow our standard.
Whoever's manufacturing food in the state.
And I just saw Marie Grant's hand go up. Marie, did you have more information to add?
Sorry, Delegate Bengel, I was struggling to get off mute there. No information to add, but I did want to note the department was a letter of information on the bill as introduced. I don't think, Delegate Taveras, and I apologize if we have, but I just asked my staff, I don't think we've seen the amendments and would really love the opportunity to just review.
No problem. Jessica, you sent it to Marie, M-A-R-I-E Grant, G-R-A-N-T. Oh, it's on the way.
Thank you so much.
Sorry, just to make sure I understand. So are there baby food manufacturers located making food here within the boundaries of the state of Maryland?
No major, but we don't have any major manufacturers. That's why we could be in a more coveted position to be able to provide more stronger enforcement mechanisms.
And I guess, thank you, Delegate. It's my lack of experience with this type of, this area of policy, but we're actually saying that in the state of Maryland, if any baby food manufacturer who wishes to sell their manufactured product in our state must adapt their manufacturing and labeling practices just to suit our state. So, for example, there's a Minnesota-based baby food manufacturer.
No.
And they want to sell here. I'm confused. So anyone could explain to me
And
how this how you operationalize this bill
Delegate,
requirement.
Delegate Lewis, we're going to hold this bill, but I want to go ahead and get all the questions out so that we'll have time to get those answers. Because I
can I
don't
just
think we
speak to
have
that real
anyone
quick?
here that can answer that question.
Yeah, I
I was
can.
looking to see if the Retailers Association was here to speak to. Okay, Delegate Taveras, you have an answer?
Yes, this is the language that was provided by California. So we are following California's verbiage in every single step. So they're very detailed in what they want to see, and we are not enhancing the language or the links in any way, shape, or form. That this is the language that has been approved and agreed to in the state of California. And they're the only ones that will be providing at a national scale the production of baby food.
And just to clarify for the members, Delegate Taveras, this does apply for any manufacturer that is operating within the state of Maryland, that is selling baby food within the state of Maryland, not just manufacturers who are manufacturing in Maryland. Is that correct?
Yes.
Okay, thank you. Delegate Chisholm.
Guess my question is, where is the FDA on this? Because FDA's got some pretty vigorous standards, and we're saying that if it exceeds the US FDA standards, which would already be a violation of the law, if I understand the way that the FDA operates.
No, I'm a guy.
You're gonna vote.
Is this duplicative? I don't know if
Can I speak to that?
Sure.
Go ahead,
Okay.
Delegate Taveras.
So FDA has only issued a guidance. So let's just start with the fact that this was just discovered a couple of years ago. And the FDA did not have guidance on these issues prior to maybe a year ago. They came out on, they were able to formulate a guidance document on arsenic. They're in the process of formulating a guidance document on cadmium and lead, but they have yet to include a guidance document or even start the process on creating a guidance document on mercury. So the FDA has been very slow-footed on these issues, in that as of 2019, they basically ignored the issue until the Biden administration came on board, and at least they've been somewhat responsive. But yet it was not until, 2022, that there was a congressional hearing on the matter for them to even start the recommendations that baby food should be tested, which was what came out of that congressional investigation.
And what about international? Is this just on US manufacturers or is it on international manufacturers? Because we get a lot of baby food internationally.
Well, that I have, at that point, I think we should provide any baby food. If you're providing a friendly amendment on that, then we're fine with that.
Okay, I'll take a look at this. Thank you, Madam Chair.
Thank you, Delegate Chisholm. Delegate White Holland.
Yes, thank you, Madam Chair, and thank you, Delegate, for the bill. I just have a question related to further enforcement. I see that this bill really relates to transparency and enforcement. Just for my understanding, when we think about product recalls, how is this bill connected to that? And just thinking about if this information is provided, then what would the next steps be? Or are there other, whether if it's federal or even state laws that would then lead to a baby product recall? Can you expound upon that? And maybe this is for another time, but I just wanted to put the question out there. Thank you, Madam Chair.
So the people have the right to complain. So what the QR code, so we are putting the label there to make sure that people are aware that they need to look up the data for that particular test result in the product that they're purchasing. If they find that they do the due diligence that exceeds the standards after, I believe, 2020, 2025, then after January 1st, 2025, then they should be able, people have the right to report it to the Department of Health. And once they do, the Department of Health has the right to investigate. If they find that there was deliberate malfeasance, let's say that they're adding, for example, in the case that we presented before the group, that they added lead chromate. They deliberately added lead chromate because that tastes and is cheaper to acquire than cinnamon. That's a $50,000, up to a $50,000 charge. However, if it's a naturally occurring product and they did all the right things except the fact that they didn't check for the soil quantities of lead, mercury, or cadmium, but they try to do all the right things, then that's up to $25,000 for that violation. So that's the distinction. One is deliberate, another one is not. But they're both, but my issue in issuing the fine is that regardless, we have to make sure that they're putting out into the marketplace safe products. And that's the reason why I feel that a fine is merited.
Okay, thank you, Madam Chair. I have a follow-up, but I'll reserve that for another time. Thank you.
Thank you. And as I mentioned to the members, we're going to hold this bill, but I do want to get all the questions on the record so that we have time to answer those questions to everyone's satisfaction. Delegate Hill.
Thank you, Madam Chair, and thank you for Delegate Taveras for this bill. And I didn't know if you wanted Delegate White Holland to finish your follow-up so the question can be on, but I can hold or continue. All right, okay. So a couple questions. I'm not clear how this applies to our cottage food industry. And you know, that I understand you said that we don't have any manufacturers in the state, so this only applies to manufacturers outside of the state. I'm confused about why we're saying, A, you have to test and you have to tell us the testing, but if you test positive, you can't sell in the state anyway. So if you can't sell in the state, I understand, but I guess I understand the transparency of the reporting if you're going to be selling the products, but if you're forbidden from selling the products, I'm a little bit confused at how those pieces work together. I'm a little bit confused about how we're saying as of January 2025, beginning January 1st, 2025, each manufacturer shall test, and it's being tested monthly. So on one line, we say it's being tested by the batch. Then we're testing monthly. And again, I'm not sure whether monthly actually makes sense, or it should be that every batch that they're making has to be tested. And I'm confused about the date about when folks in Maryland who already have it on the shelf, because it says if it was manufactured before January 1st, 2024, and if it was warehoused and sold as of January 2025, they can sell, but there's a gap between manufactured between, after January of this year and before the bill goes into effect. And I'm not clear what happens with, distributors who've bought products that were manufactured this month and this bill hasn't even gone into effect, and what they're able to do. So those are my questions.
Okay, Delegate
Taveras.
Yes.
We're just going to hold the question so that we can get some answers. We can work with counsel.
Okay.
We can also work with the Retailers Association so that we're getting clarity on some of these, because I think there are some questions about how this interfaces with interstate commerce, and also how it has worked in I think you said California, where they have already implemented this law. So we'll get those answers. We'll get those answers for the
Madam, can I
members.
ask my other question, which I almost forgot, so we can get it on the record?
Yes, go ahead.
Okay, what I was not present at the hearing because I was in another committee, but I'm looking for the data that tells us, particularly in California, where they've apparently done this for a while, how often are we finding that the contamination is there at levels above what the FDA allows, and what that effect is. So are we doing this for,
Oh, you just muted Delegate Hill.
whether it's
Are we
1%
doing
of
this
the
for-
batches or 20%? So obviously we don't know until we test, but obviously somebody's testing. I'd just like to know how often these tests turned out positive. Thank you.
Thank you, Delegate Hill, and we'll get those answers so that everybody understands this bill and how it interacts with state and federal law. Delegate Riley.
Thank you, Madam Chair, and thank you, Delegate, for the bill. Most of my colleagues that spoke before me mentioned a lot of the things questions I had. I just want to kind of talk about, I think Delegate Hill mentioned the testing. If they're testing per batch, then, and it's okay by FDA standards and then our standards according to this bill, then what is the purpose of continuing to test it? Does the metal grow in the product as it sits on the shelf, or why would we test it again? So I don't quite understand that. And then the other thing was, okay, so the selling again, if we're going to not just be our manufacturers here in Maryland, but now we're saying that other manufacturers in other states and plus selling it to the state, I think there's an issue there. So we need more clarification. And then also with the Maryland Retailers Association, I know during the hearing, they had said, they would just kind of be neutral, just information only, if we were to take the amendment. So I'm assuming these amendments are from them.
Yes.
One question. But then they're still, from the hearing, now just clarification on that, they're still not in favor of the bill with the amendment. They just are, I guess you want to say neutral or just a letter of information.
No,
More comfortable with it.
well, we'll get clarity, but my understanding is that they're favorable with the amendments now.
Okay, all right.
And it does account for all the interstate issues that were raised.
Thank you, Delegate. All right. Thank you, Madam Chair.
Thank you. And thank you, Delegate Tavares, for being here to answer all of our questions. We have time. So we want to make sure that folks understand the bill, what the amendments do, and how it interfaces with our other commerce laws.
No problem.
So we will get answers for everyone. We're going to hold that bill.
All right. Thank you.
Thank you. And I know Rory has been writing feverishly to make sure that we were capturing all of the outstanding questions. So we will work to get some answers and some clarity. We're going to go ahead and move to House Bill 393, Higher Education Maryland Dent Care Program Eligibility. So this is my bill, but the Maryland State Dental Association has a proposed amendment. So Aaron is going to speak to what the bill does now as unamended, and then I'm going to allow Dan Doherty from the Maryland State Dental Association to speak to the proposal from the association. Aaron, go ahead.
This bill expands eligibility for Maryland Dent Care Program to include part-time dentists or dental hygienists. The bill also authorizes the Maryland Higher Education Commission's Office of Student Financial Assistance in collaboration with the Department of Health to establish prorated loan repayment assistance for part-time dentists or dental hygienists participating in the program. The bill also clarifies that as a condition of eligibility for the program, an individual must be licensed to practice in Maryland by the State Board of Dental Examiners under a general or limited license.
Thank you, Aaron. As a reminder to the members, this is essentially, it expands the pool, but not the pot. And the bill was heard, I believe, on the same day over in the Senate. So I'm going to go ahead and open it to Dan Doherty from the Maryland State Dental Association to talk about proposed amendments, and then we can have a conversation about the amendment.
Thank you, Madam Chair, members of the committee. The amendments that have been proposed by the State Dental Association are short version to eliminate the awarding or the eligibility of limited licensed dentists and dental hygienists to be recipients of these grants. First of all, there is no limited licensed dental hygienist. Limited license only applies to dentists. It applies to internationally trained dentists who are going through the educational and qualification requirements under Maryland law to become fully licensed. The program was as established was to offset debt incurred by dentists who have completed their education, have come out with massive student loans, some in the area of over $300,000, and encourage them in return for the grant to practice for 3 years in health professional shortage areas. And after those 3 years, hopefully to establish roots. They must practice for 3 years in those locations, and they must commit to treating at least 30% of their patients' population must be Maryland Medicaid program recipients. We're really trying, by using limited licensed dentists, trying to put a round peg in a square hole. These dentists, internationally trained dentists, are still going through their educational process. They have 2 courses, avenues, one of which includes 2 years in dental school, taking additional courses. The other is, in lieu of that, committing for 2 years to practice. I'm going to use the broader term public health clinic, but it's FQHCs, et cetera. They get paid for that. They get credit towards their ultimate degrees, but they are not those candidates yet who should be eligible for applying for these grants because they haven't completed their education and they are not licensed. Once they have done all of that, then they would be in the pool that can apply for the grants. So we feel that the terms limited license should be deleted for hygienists because it doesn't exist, and should not be applicable to the internationally trained dentists because they are not at that position in their licensure status where they should be eligible for these grants.
Thank you, Mr. Doherty. I'm going to open it up to the members if anyone has questions.
Move the amendment.
Second.
All right, the amendment has been moved and seconded. Are there questions on this amendment? Does anyone want to be heard on this amendment? Again, this is just for discussion purposes. Robin Elliott.
Good morning, Robin Elliott here on behalf of the Maryland Dental Action Coalition, as well as a group of federally qualified health centers called Maryland Community Health Systems. Limited licensed dentists do have educational debt that they've acquired in the U.S. And they work in FQHCs or local health departments for at least 2 years before gaining unrestricted licensure. But during that time, they still have to pay their educational loans from here in the U.S. We've heard from many FQHCs in particular that these internationally trained dentists are essential in rural areas. They cannot recruit enough dentists, and therefore we would request respectfully that the committee not adopt this amendment.
Go ahead, Mr. Patty.
Thanks, Madam Chair. I just had, I think, one thing that's important to clarify when we talk about process. So an internationally trained dentist completes more education in the United States at a dental school, completes a fellowship, and then is required to complete a 2-year contractual obligation at an FQHC. But the limited license is awarded once that internationally trained dentist has the contractual position lined up. So they've completed their education at that point. The last thing separating them really from the ability to get the unrestricted license is that 2-year work requirement. But while they're under that work requirement, they have a limited license. So I think a more accurate statement would be that their education is complete. They're just on that work requirement. So I think that, I would stress again that, this program has value, and these internationally trained dentists have a limited license are seeing these types of patients, should be eligible for the loan repayment program.
And Mr. Patty, just to clarify, because I think we talked about this in the bill hearing, but just to clarify, this would make them eligible for reimbursement for stateside student loan debt, but doesn't change any of the other standards. Is that correct?
That's my understanding, yes.
And Mr. Doherty, I see your hand up. Just one more clarifying question, and then we'll go back to you. Whoever can answer this. Sorry, I got a text and I got distracted. Mr. Doherty, go to you, and then I'll go back to my question.
Who are you
Go ahead,
going to, Madam?
Yeah.
What me? I have to disagree with my colleague, Mr. Patty. Number one, they take this a contract for 2 years in a public clinic in lieu of 2 other additional years that would require they would require to take in the dental school. The provisions he's referring to deal with the fellowship specified for pediatric dentists. Pediatric dentists not only have the 4 year of dental school, but they have a residency program. So when the dental school requests that an individual be granted this general limited license to go into a clinic, and the head of the clinic asks for that also, then they're eligible. But they still have not completed all the requirements. Ms. Elliott said that they incur debt. We are not disputing that. What we're saying is, when you've completed your education, when you have gotten your general license, that's the point in time when you make the commitment as an internationally trained dentist with a general license to go into an underserved area in practice and commit for 3 years to provide services to at least 30% of the Medicaid population. This is doing it, in our opinion, prematurely, and it's really allowing them to get benefits for 2 year commitment while they're getting their education versus the 3 year commitment of the dentist who has completed their education in any residency. So we just, as I said when I started, this is sort of a round peg in a square hole.
Thank you, Mr. Doherty. And I remember what I wanted to say is that this bill just expands eligibility, but does not guarantee approval. Is that correct?
That is correct.
Okay, thank you. Delegate Hill, Delegate Rosenberg, followed by Delegate White Holland.
Okay, thank you. I just wanted to, again, get some clarity here. Public health students generally who sign up for the public health services with the understanding that there will be debt forgiveness, military folks who sign up with understanding of debt forgiveness. My understanding in those cases, and I know that's our federal programs, but debt forgiveness comes, or which is similar to this granting of money to help pay off those debts after they finish training, not while they're in training. And if I hear you all correctly, and maybe this question is for Ms. Elliott, because these dentists have trained in another country, when they come here, they have to go additional residency training under this limited license to be sure that they understand the standard of care and they can practice. And you're saying that as they're here, before they completed that additional residency, you want them to be eligible because you think this will incentivize them to take these FQ jobs, which they're required to take anyway. And Mr. Doherty saying that the pool is so small financially that they can be eligible after they've completed the 2 years. Am I understanding this right, Ms. Elliott?
I'm gonna if it's okay, ask Michael Patty, who's done extensive work on the pathway.
And who's Michael working for? Because he's been through, I've known him for so many years. I don't even know who he represents anymore.
So today is the Maryland Dental Action Coalition. But I think we're combining two separate processes to get to that end result. So an internationally trained dentist goes to school, does a residency, does a fellowship. And then to complete their licensure pathway, once they have retained a 2-year.
I'm sorry, I have to interrupt. Does their training where and then comes here and does what here? This is.
So here they would do so an internationally trained dentist that comes here would have to do a 2-year residency program attached to through a U.S. dental school, and then a fellowship program, again attached through a dental school, and then after having completed those 2 requirements, the last requirement would be, before they're eligible for a general unrestricted license, their last requirement is a 2-year work requirement. But once you have attested that you have that 2-year work requirement and you start that, you as an internationally trained dentist are operating under a limited license. So you are licensed by the board. So if you look at the current language under the law, it says if you are licensed by the board, you're eligible for this program. And we're just clarifying, because this program's close to 20 years old. We're clarifying that if you in fact have a limited license, which means you've met your educational requirements, that last work requirement, which I'll stress is very unique to Maryland, you're operating under a license, then we feel that you should be eligible to apply for the Dent Care program. And I recognize the pool of money. Again, I'll stress what the chair said. We're just opening up who can apply. But I think the education pathway and this work requirement are 2 separate things. And I think, we may be conflating it into one bucket of information, when I think it should be really separated. You have a limited license to practice in this state with certain requirements. I still think, we still think that you should be eligible to apply for this loan repayment. And I recognize that there's a 2-year requirement and there's a 3-year requirement. I think this will still entice people to stay in that public health space.
What, I'm sorry, what is the work requirement is linked to what? So typically work requirements, as I said, like in public health, are linked to the fact that people got, there's a loan repayment piece, there's some granting in it, or you got scholarship to go. And in return for that, there's a work requirement. So what is this work requirement linked to?
This work requirement is linked from an internationally trained dentist with a limited license being eligible to receive an unrestricted license in Maryland. There's a very narrow pathway that says currently, if you're a pediatric specialist and if you're an internationally trained pediatric specialist, the only way that you can receive a unrestricted license to practice in Maryland is to serve 2 years in public health. And then after you've done that, you can apply to the board for your unrestricted license. That pathway is completely independent of what we're talking about with expanding the eligibility in the Dent Care program.
So would it be reasonable to say, it sounds like that's a payback. So, and this is sort of just coming to mind. So would it be, as you're explaining, would it be reasonable to say that you either are eligible for this fund or you pay back time working in these communities for these clinics? Because they seem like it's sort of a double penalty, not penalty, but it's a double cost. And in other words, the work requirement was part of the cost, right? I mean, that was extracting some labor for the privilege of being able to come here and go through another residency program. And as you learn the standard of care. So, I mean, it sounds like the 2 things are trying to do the same thing. It's saying you're coming from another country, therefore you have to do a little bit more. And up until now, it's been you give the work requirement. And if they're eligible for the fund, should the work requirement go away?
Madam Chair, could I respond?
Yes, but I'm gonna say something first before you do, Mr. Doherty, because I think Delegate Hill just, expressed the reason for retaining limited licensure, which is that work requirement doesn't go away. It's already built into the the pathway. I
But
think that this bill just speaks to the fact that the people who are already on this pathway and already doing this work requirement should also be eligible for the same loan reimbursement as somebody who isn't necessarily on this pathway.
but
And
respectfully, though, that's not correct.
well, and that's why we're having this conversation. I do want to be cognizant of the time. So Mr. Doherty, I'm going to call on you. I'm going to call on the members. We are going to hold this bill for consideration of the amendment. We have one more bill. So Mr. Doherty, go ahead, and then we're going to call on our other members so we can get any outstanding questions on the record.
There are two pathways for an internationally trained dentist to become licensed. One is they go through prescribed requirements, which include a 2-year pre-graduation from dental school group of courses. When you look at this section, it currently applies only to pediatric fellows at the dental school who are internationally trained, but the language is the board will waive the requirements to issue a license. In the other instance, they can't get a general license. The only way they can, a limited license. The only way they can do it is to take the second pathway. And that is to commit 2 years to working in public clinic. And in return for that, they get compensation and they don't have to take the 2 years in dental school courses.
Okay, thank you for the clarification, Mr. Doherty. Delegate Rosenberg, followed by Delegate Lopez.
Thank you, Madam Chair. I guess the question for me, and I've introduced and enacted bills creating and furthering loan assistance repayment programs, is which alternatives, if that's a fair way to put it, are there alternatives, best enables a student to continue his or her education, provide service, care, dental care to people with less income, and then also assist that dental provider in reducing his or her academic debt. I would think that's what matters to me, and I would hope I'm sure to the full subcommittee. So,
well, removing the limited license does not disqualify these internationally trained dentists for applying for grants once they have gotten their general license. They're in the same status as someone who's from Maryland and goes to the University of Maryland School of Dentistry, gets their degree, does their residency. That's the time frame when these individuals should be applying, not while they're still meeting their qualifications for full licensure and only serving 2 years of a commitment, which is in return for having 2 years of education waived.
Thank you, Mr. Doherty. Delegate Lopez.
Sure. Thank you, Chair Bagnall. I have a quick question. I just need to have my memory refreshed a little bit. Were there any concerns from our Department of Health or the Board of Dental Examiners or MHEC about inclusion of the limited license? No?
No.
Not formally, no.
Thank you.
Delegate White Holland.
Thank you, Madam Chair. And we might have covered some of this, and I just want to make sure that I understand it correctly. But it seems to me that this bill would essentially just expand the pool of those eligible, whether they would be eligible now or later, given the conversation about timing. So I just want to make sure that I understand that correctly. I suspect that that's what it is, but
that is correct.
Thank you. But isn't this essentially, and I think this may pair with previous comments, but isn't this just another tool that we are just considering adding to our toolbox to ensure that those that are internationally trained can better serve in HPSAs? I mean, isn't this being used as a way to better position them to serve in areas where we are experiencing shortages and where there is need?
That is correct.
Thank you.
So once again to the members, Delegate Riley.
I'm sorry, Madam Chair. So I do have, basically, we're going to allow them to come here and then get possibly their debt paid through this program, and then possibly with no commitment. So they're a flight risk.
That is incorrect. That's not what the bill does at all. This is a reimbursement bill for and I think Ms. Elliott can respond as well. But this is a reimbursement bill. It just expands the eligibility for applying for reimbursement. But it's for providers who are already working and have already committed to an FQHC.
Okay, but they don't have to
other
finish.
other public health
Okay.
center.
All right, one more question then before we go, and then I'll be done. So I have a bill hearing actually. So do shoot, I was gonna say. Oh, so I am so sorry. It's like it just went away. That's age.
It's okay. Do you want Miss Elliott to
Oh, she can,
answer
yes,
your
answer that
question?
one then. Yes.
What you're thinking?
Yes.
Delegate Riley, I appreciate the predicament. Just to let you know, these if they applied and they got loan repayment, these limited licensed dentists would have to meet the same work requirements as anybody else participating in the program, not less. And this idea really originated actually from our Eastern Shore federally qualified health centers who really rely very heavily on limited licensed dentists. I'll just flag someone could go on to become an unrestricted licensed dentist, but there may be cases where somebody is happy working in an FQHC or a local health department for longer. And I think it's the same. These folks have been here for 5 years, really by the time they're in this program. And like I said, it was requested by our rural FQHCs.
Okay, thank you. I did remember the question after. So currently, because this is a limited program for, reimbursement for payment. Do we know how long is there a waiting list for the current, under the current regulations, and who is able to qualify? Is there a waiting list that we currently have and we're just going to add to that waiting list? I don't know how it would help if that's the case.
If I could answer, I wouldn't call it a waiting list, but this year there were 23 applicants.
Okay.
The Department of Oral Health wanted to fund 8 dentists and 5 hygienists. They were budgeted monies for 2 positions. So 21 applicants are excluded at this point in time because of funding.
Okay, thank you very much. Thank you, Madam Chair, for
Thank you.
your patience. Thanks.
Of course,
I do
Delegate
have to
Riley.
leave. I have a bill hearing and appropriations, so.
Absolutely. And just to
Oh,
remind the members that this does not change the fiscal impact. We recognize that we're hoping expanding eligibility will also send a message that we need more funding for anyone who's watching. We're going to go ahead and hold that bill. And we've got one more bill, so I want to at least have the conversation and see where we can get to. This is House Bill 548. This is the Task Force on Responsible Use of Natural Psychedelic Substances. Aaron, if you can walk us through the bill and also following information. I'm losing my words too.
It's okay.
That's it.
There's a reprint that's been provided, and it's the bill as amended by the bill sponsor, Delegate Gazzoni. So the bill would establish a task force on responsible use of natural psychedelic substances. It has been amended so that the Maryland Cannabis Administration would staff the task force instead of the Department of Health. The task force will study existing laws, policies, and practices related to the use of natural psychedelic substances, the best available science and data on public benefits of responsible access to and use of natural psychedelic substances, opportunities to maximize public benefits of responsible access to and use of these substances, the best available data on potential risks of access to and use of, we need an acronym for this. These substances, opportunities to mitigate potential risks of access to and use of these substances, and barriers, healthcare practitioners and facilitators may encounter relating to natural psychedelic substances. And then the task force will make recommendations regarding any changes to state law, policy, and practices needed to create a Maryland natural psychedelic substance access program that enables broad, equitable, and affordable access to psychedelic substances, including permitting requirements, including requirements regarding education and safety, access to treatment and regulated support, and production of natural psychedelic substances. And then many of the recommendations that were included in the bill as introduced have been stricken. However, there is remaining language that the group would make recommendations to transition from criminalizing conduct involving natural psychedelic substances, including punishing with civil penalties non-violent infractions involving the planting, cultivating, purchasing, transporting, distributing, or possessing of or other engagement with natural psychedelic substances, expunging the records of Marylanders with convictions for non-violent criminal offenses relating to these substances, and releasing Marylanders incarcerated for non-violent criminal offenses relating to these substances. And then the amendments authorize the task force to consult with the experts and stakeholders in conducting their duties. The task force will report to the General Assembly on or before July 31st, 2025 with their findings and recommendations.
Thank you, Erin.
Thank you.
Thank you, Delegate Hill. Do I have a second?
Second.
All right, the amendments have been moved and seconded. Let me go ahead and open it up to the members for questions first, and then I know there are some people that want to be heard on this bill. Delegate Rosenberg, I see your hand. Oh, you're good? All right. Any other members have questions? Who would like to be heard on this bill? I saw Mr. Sterling.
Yes, thank you, Madam Chair. I wanted to suggest that the committee amend the definition as I testified last week. The current definition is narrow in ways that would interfere with the ability of the task force to consider certain studies of mescaline. The four compounds that are identified all exist in various plants and fungi, and many of the studies that have been done regarding their use and their safety have been done through studies of people who've ingested the material through the plants rather than in their pure form. And so I'm suggesting that the definition not exclude peyote and that it not use a vague term naturally derived, which I don't think really has a meaning, and that the language that I suggested on page 4 of my written statement be substituted for the definition. Thank you, Madam Chair.
Thank you. Erin, I'm going to turn to you because as folks know, we have to be very careful with health policy and not being too prescriptive. And I wanted to see if we needed to be more clarifying, given that it's a task force that will be studying this. Erin, I don't mean to put you on the spot.
It's okay. No, I mean, the fact that it's a task force does, provide a certain level of comfort because we're not, making any policy decisions related to criminalization or recreational use or anything like that of these substances. So it is true, the fact that it's what the task force is looking at, I guess, is not as dangerous per se when defining the term.
Because the task force will be making recommendations. Is that correct? Okay.
Correct.
Delegate Hill.
Thank you. And I am a co-sponsor of the bill. I am concerned that it's very prescriptive. And I think this may be to what the gentleman was saying about we're only listing certain things. As this committee knows, ibogaine is another agent that I've made clear that I think should be studied, and the fact that it's not listed is problematic to me. And so I think the suggestion of not being prescriptive and listing, or else listing and saying in other substances that the task force may deem to be appropriate for potential beneficial effects or something like that. I just trying to get the sense of the committee we're describing these four things, and I don't see any room for other things to be considered.
And I think we're also going to hold this bill. But I think, Aaron, can we work with the sponsor and see if we can and capture language that would give us a little more flexibility in what
Yes.
the task force looks at?
Of course.
Is that agreeable to the subcommittee? All right, I'm seeing a lot of head nods and thumbs up. So we are going to hold this bill. We're going to look at how we can have some clarifying language that maybe gives the task force a little more flexibility in terms of what they're studying. Are there any other outstanding concerns on this bill so that we have time to address them? I'm looking for hands. Oh, Delegate Chisholm.
One quick question on this. Where does the federal government stand on psychedelics? Are they outlawed?
Mr. Sterling, do you have an answer? Go ahead.
Delegate Chisholm, currently most of these are in Schedule 1. This is where they've been for a half a century. At the same time, the Food and Drug Administration has approved a lot of research into the area, and there are clinical studies that are taking place with some of these materials. It's a very rapidly evolving area, but as you know, the federal government, meaning the Drug Enforcement Administration, has been very, very slow to move forward, even with a compound like marijuana, which has been legalized for medical use in Maryland since 2013 and in many other states.
Yeah, that's why I asked, because it does seem like it's caused a lot of complexities between what state rights are and what federal DEA laws, and I just want to make sure that we do this in a way that it's not conflicting or inadvertently causes legal troubles for people.
And I think we appreciate that, Delegate Chisholm, and to that point, creating a task force does give some level of comfort as we are looking at what other states have done, best practices, and how how we can move forward on responsible use. So Delegate Hill.
Thank you, Madam Chair. And I guess this question is really for Aaron, and I'm looking at the amended language and I may just have missed it. I raised this during committee. The way the bill is written, there's a presumption that this is where we should be going and this is all good stuff. And I still don't see language that says, or the deleterious effects that. So am I wrong? Is this commission also a work task force also going to look at, potential
accumulate that discount to the
negative or unhealthy effects or the dangers of?
Delegate Alston, you're unmuted.
If there's a discount off.
Oh, shoot, sorry.
Sorry.
Because I'm concerned when we don't look at the whole piece and we roll forward. And I think there's substantial evidence of the benefit. So I'm sorry, I think I've stated the question, right?
Aaron, can you speak to that?
There is a line about the task force, page 3, lines 22 and 23. That's available data on potential risks of access to and use. So at least it's out there, that there are risks.
Thank you for
And
pointing
then
out.
opportunities
Not
to
there, they
mitigate
won't
those
look at
risks.
it.
And Madam Chair, lines 24 and 25
Yeah.
also talk about
Right.
the potential risks.
Thank you. Thank you very much for that question, Delegate Hill, and for the answers. We're going to go ahead and hold these bills, and committee, we have time. You're doing a great job, subcommittee. But we want to make sure that we understand everything to the best of our ability. And so we're going to get some answers for you. It is 12:16, so I can give you some time back before our bill hearings at 1 o'clock. If I can have a motion to adjourn.
Move to adjourn.
Do I have a
Second.
Second.
All right, it's been moved and seconded. Thank you all very much. Enjoy your lunch, and we will see you at 1 o'clock for bill hearings.